Next, I invite our own ocularist, Mrs. Celia. She did her fellowship in optometry and ocularist in prestigious LVPI Institute, and currently she is working in many places in northern part of Kerala as well as in Coimbatore and Bangalore. She'll be talking about prosthetic, all you want to know about the prosthetic eye.
Thank you, Dr. Indu. Hi, good afternoon, everyone. Mostly non-faces all. Actually, in 8 minutes, I don't know how much I can tell about the prosthesis, know all about prosthesis. And this is like ocularistry field who deals with ocular prosthesis. And ocularist who is specialized in fabrication and fitting of ocular prosthesis. Usually in 5th century, people always have disfigured parts in their face. So they, in ancient times, in Roman and Egyptian, they used to cover with something over the socket or inside the socket. So they used to use that clay, painted clays or painted clothes in front of the socket. And then in the medieval century, we invented metal. So gold with colored enamel they used to use. And in Germany, glass blonde techniques happened in Germany. So glass they used to use. But for the glasses, always we have a disadvantage. It can break and it can cause some irritation in the skin. So and then nowadays we are using medical grade acrylic plastic. It's a very good material, PMMA, polymethyl methacrylate. And nowadays we use even 3D irises also in ocular prosthesis. Stock eyes, this is like ready-made eyes in all clinics. Maybe all ophthalmologists will have one case. We'll have a different varieties in different shapes and sizes. And if we don't have any other customization option, then we can go for this sometimes. And let's see that what is the advantages of custom-made prosthesis over stock eyes or ready-made eyes. This is absolutely prepared according to the socket measurement and made up of good grade plastic, PMMA. And always this will decrease the discharge and discomfort and good symmetry with the other eye. You can see that the difference between the stock eyes and customized one. In the first one, we can see that we corrected ptosis with the customized prosthesis. And the second picture, we have a very with a stock eye or ready-made eye, we won't be able to get a good symmetry. And you can see with the customized one. And we'll get mostly good prosthetic movement if we have a very good measurement and very good socket impression. We mostly will have satisfied movements. And this is like a socket expansion we do with we have seen in previous presentations. We use very mild buttons from the starting for a congenital anophthalmos or a microphthalmos, and we gradually increase the size of the conformer, and then we will get at the age of 3 or 2, it depends upon the patient. Sometimes we'll get a very good cosmosis. And this is scleral shell. Sometimes we in atrophic bulbar pre-thesical cases, we don't get enough folium. We'll get a very thin prosthesis that we called as scleral shell. And when we come to the fitting process, there are some key factors we'll see for the eye fitting. That is mainly size of the eye and shape, color, pupil size, and iris color. Sclera color, and the background of the sclera will have some kind of color, and even veins. And if any patient have a particular pterygium or any arcus, any kind of pigmentation in the sclera, we'll see that also. Usually we'll start with the evaluation of the socket that Dr. Shebin already talked about. We have a complete performer for a socket evaluation. From the, if the patient is having a prosthesis already, we'll assess that prosthesis. If it is a stock eye, we'll assess that also. And movement, socket volume, everything. After that, we'll take an impression with the alginate, which is hydrocolloid material. Even we use sometimes silicone impressions also, if we want to stock it for some time. And this is alginate. We'll have an impression trace with a different size and shapes for the right and left eye. we'll select according to the socket evaluation. We'll select a impression tray and we'll inject the alginate into the socket, and we'll get within 1 or 2 minutes. So we'll get a very solid impression. And after that, we will make with that impression, we'll make a wax model with a medical grade wax, which we can insert into the socket, and we can see the shape and size of the eye, and even in the alignment also. So we'll decide in this wax modeling, we'll decide the size, shape and alignment, everything. And then that this wax model will convert into a PMMA material. And after that PMMA, we'll make a iris also. In that PMMA, we'll make iris. We'll paint the iris with the patient only, and we'll attach with the pupil button. And after that, that pupil will be attached to the PMMA, the whole size. And then after that, in that sclera, we will color all these details, even the limbus detailing. And the sclera, even if that patient have any pigmentation or any dilated blood vessels, everything will do in this step. And after that, over that, we will cover this with a clear PMMA coating, and then we can dispense that patients after all the polishing. For the care and handling, we have two techniques. We can use hands to take it out and put it back, and also the plungers also we can use. I usually, personally, I won't prefer this plunger, because always the patient will have some kind of water content inside the plunger, and they will come with a fungal infection or something, because they never wash these plungers, and they don't deal with this. So and we can, I just written this clean the prosthesis every day is ideal. Sometimes it is not ideal, because if the patient is not going for any kind of construction work or any dusty area, then they can just take it out with once in 2 weeks. It will be also good. And sometimes if the patient is in a very comfortable room, and they're not going out and not dealing with any other things, then we'll say that once in a month also, if they can use a very good refreshing tears, any lubricant eye drops 4 to 5 times in a day, then that will be great. Usually people won't have any problem with this. And sometimes once in a month or once in 2 months, they can use a mild baby shampoo to clean this. And usually we'll say that in every 6 months the prosthesis should be polished professionally, because they will have some kind of deposits in the back side of the prosthesis, or even some scratches in the front side also. So it should be polished at least every 6 months, and compulsory once in a year they have to polish it. And when to replace it? Normally this PMMA is a very good material, and that lasts for years, 10 years or 15 years they can use without any problem. But sometimes even in the changes in the socket also happen. So that time if the patient is not happy with the cosmesis, they can go for a new one. And sometimes recurrent infections after polishing also, they are dealing with the same infection, then we can go for a new one. Or dryness, discomfort, and even any kind of size difference, and the patient is having a ptosis experience, then we can go for a new one. And sometimes popping out very frequently, patient used to complain about this. It will come out easily because the socket is big and the prosthesis is small, then they'll experience this problem. Then that time also we can go for a new one. If no other problem happens, they can every 6 years we'll say that to change the prosthesis, but often they come to us after 10 years sometimes. So these are some patients. And we sometimes not all every time the prosthesis will be in a good size. Sometimes it will be small and big, even though after the surgical correction we'll get these kind of problems. So we can use mild these kind of optical illusions. We can give plus power to enhance the size, or minus power to minimize the size. We can use the even prism also. In some axis we will get a very good cosmesis. And thank you.